Hello, my friend, and welcome to this session on the patient experience blueprint and how to improve what's happening at your practice, the comfort level that your patients experience at your practice with simple words and natural ways. My name is Juan Acosta, and I am the Natural Comfort Specialist. I am a hypnotist by trade from hypnodontist.com, and I started in dentistry not knowing what I didn't know. If you've maybe made a similar mistake in anything you do in life of thinking that you already know what you're about to encounter and then getting there and realizing that things are different. When I started pursuing dental practices, I wanted referrals. All I wanted to say was, hey, I'm building my hypnotherapy practice. I would like to talk to your patients who are grinding their teeth or smoking or nail biting, or they have symptoms of fibromyalgia or cancer, or any of those sort of hypnotherapy related items. So my initial approach was to ask for referrals. Give me. And I realized quickly, because I landed just out of sheer luck, I landed a great opportunity to be a dental office manager because I hit it off with one of the dentists that I was communicating with. And I realized quickly that dentistry is a lot harder. It's a sort of misunderstood profession, in my opinion, and it makes it kind of difficult with the public because the public doesn't see what we have seen. Now that I've been behind the desk inside many dental practices, I realize, and I realized this early on, that what the public sees and what the public perceives is very different from what actually the reality is. Those memes that you see, what my friends think I do and what I actually do. This is the kind of thing that happens, I think, in dentistry. So when I started working in the field, I realized that dentistry is misunderstood and it's a hard profession, and that makes it to where it's a stressful profession. And it being that my background as a hypnotist, hypnotherapist is in stress relief, mindfulness, meditation, how to sort of get rid of these conflicts that are going on in your mind and not letting you do what you want to do or reach your highest potential, made me think about dentistry in a different way, as in, well, if I can teach certain simple communication skills and ways to maneuver through conversations and connect with your patients that you can use, that a team can use with their 1,000 or 2,000 or 3,000 patients in their roster, don't know how big your practice is, then I am multiplying my impact in the way that I would like. So I started working on this program, which now I called the Patient Experience Blueprint. And before we get going, I'd like to share with you that the reason, my motivation for doing this comes from, a bit of feedback that I received sums it up best. I had a doctor from Canada who took one of my courses with Dr. Munir Ravalia. And the feedback after the course was, oh my gosh, this was several weeks after the course and practicing what we had taught her. And her feedback was, oh my gosh, I can't believe that I could practice dentistry without stress. I didn't know I could practice dentistry without stress. And to me, that's very telling because dentistry is a stressful profession. And I'm not only talking about the dentist, I'm talking about the hygienist, the front office people, whoever you are, the dental assistants as well. Everybody that works in the field that is misunderstood is actually having a bit of a hard time in their own way. So my program is meant to ease the stress that you go through in a daily environment of working in dentistry. Because if you think about it, if your goal now becomes going to the dental practice where you always go to, and you're still getting paid and all things are equal as they were. However, now after listening to this, maybe you feel like you're not just going there to do a job, but that part of your job is to make friends and to actually enjoy that connection with your patients. Then I think that you will probably feel like you're getting paid more than you are getting paid right now, if you didn't feel like that before. So what I'd like to really share with you throughout this entire process is that it's all about the relationship that you build with that patient. If you think about it, a patient that is very happy with you and you have connected with so much, and are they going to go to the dentist down the road when they have an issue, or are they going to come back to you? Right? If somebody asks them for a referral, are they going to send them to some other dentist, or are they going to send them to you because you have a relationship? right? So it seems very basic, very simplistic, but it's not. It's actually the very basis of building a sustainable practice organically, not a practice that you need to continue to pay money out to see a result, which is kind of where our story starts, really. When I first got to manage this practice, I didn't know a thing about dentistry, but I knew that. When I walked in, I said, "Doctor, I don't know anything about dentistry." And he said, "Doesn't matter, you have great people skills. I can teach you the things you need to know about dentistry to be an effective office manager." And that he did. And after that, I also worked in another one of his practices as a patient coordinator. And then I went on to consult with other practices and speak and teach with hundreds of dental professionals in all roles of the practice. So what I'm sharing with you comes from personal experience, from having the background knowledge of being a hypnotherapist, a hypnotist, and sort of understanding the workings of how people do and why people do what they do, and then stepping inside the dentistry profession and going, whoa, this is messed up. There's a lack of communication skills on one end. There is a misunderstanding of what's happening in the profession on the other end, right? Our patients think that you're making a killing and life is super easy for dentistry professionals. And you and I know that it's not, right? It's a very stressful environment in many ways. We don't like to cause pain. Nobody in the dental office likes to cause pain. However, that's one of the biggest fears for people that are coming to the dentist, right? So there are many issues why we want to improve that patient experience, because if your idea is to continue doing this profession, whether you are a front office manager, an assistant, a hygienist, a doctor, whoever you are in that practice, is this a profession that you see yourself doing for a long period of time? Long term, is this your lifetime profession? Or maybe not, right? So think about this, because if it is, then I encourage you to really begin to make an effort to build those relationships as strongly as you can and as joyfully as you can, so that you'll have a better time at work. People will have less pain and they will present better to you if they're in a better mood, right? So if we start with who's the better patient, right? The comfortable, relaxed, happy patient, or the unhappy, annoyed, uncomfortable patient who's nervous and who's scared of needles, right? Who would you take on that balance, right? So if you know that you can actually create have an effect in how that patient feels and help them become that patient, that comfortable, relaxed, happy patient that goes, wow, I wonder why everybody complains about dentistry. Dentistry is so good. Well, no, it's not dentistry, it's us, right? It's the people in that group. Now, I would love for the perception of dentistry as a whole to improve, because things, quite frankly, would be a lot easier. However, we know that that's really difficult, improving the public perception. But can you do it in your practice? Can it start with you? Yes. The answer is yes. So I'm going to share with you, I don't want to call it an overview, because besides an overview of sort of how I break down this patient experience blueprint for you, I'm also going to give you one key element from each of the frameworks. I have prepared 3 frameworks that deal with the 3 sort of main issue areas, main problem areas that I have identified in the dental office when it comes to communicating with patients and building relationships. That's my entire focus. So if you'd like to download this patient experience blueprint handout, you can go to hypnodontist.com/blueprint, and it will take you to this, and it's a packet. So it'll come with a few other things that I will explain later. But right now, we're going to work with this one. And I have an abbreviated version here. You will have the full version there. And if we ever get together for one of my live presentations of the blueprint, then you will be able to go through that same basic workbook. All right. So in the front page of that workbook, of course, you can pause the video, download if you need to, and then come right back. And in the front page of that workbook, you see that I have set it up as a triangle, and there are also a few circles, 3 circles. So I think the most basic issue, the most basic problem that plagues a dental practice is the sort of bad relationships, weak relationships. So I want to put that right here on the base, because of course it is the foundational step. If you have weak relationships, then that patient who is like, well, I don't know if I need to do that work right now or need to do it later, and they end up putting it off. When the time comes, they may not come to you because they're like, well, they treated me, I don't know, it was okay. It was just okay. I'll go down the road and see if maybe they wow me over there, right? So you want to be that wow, right? You want to build that relationship. So for the first thing I like to do with this graph is to identify those three main issues. The first one being weak relationships, and that being an issue because then people don't feel attached to you and your practice. And that in turn obviously doesn't get them to multiply and to bring their friends and family. So it continues to put strain in your wallet, whatever you are in the practice. If the practice has to put money out to create a great coupon, to then mail out to thousands of people, to then get a small percentage of people in, that money that is going out every time is money that the practice is not getting to keep, right? And wherever you are in the practice, whether your role is as an assistant or the doctor or the front office or hygienist, it doesn't matter who you are in the practice, that or issues of money roll downhill, right? If the practice has that extra money because all things are going well, all systems are working efficiently, then there is more money for taking employees out to dinner, maybe a bonus. I don't know. Every dental office works a little bit differently, but just understand that it doesn't matter where you are in the practice, you do have a vested interest in making it work as good as possible. The second issue that I have identified, and we're going to put that on that left, we're going to go clockwise. Second issue that I have identified is broken schedules. Nothing more frustrating than setting up a time with the patient and then them not showing up. That is a huge issue because in that time where the chair should be producing, right, there should be somebody sitting in that chair making the practice money. The practice is still eating, the doctor is still sitting there, except now they're twirling their thumbs for a little while because there's no patient or they're doing something else, most likely, but you know what I mean. That is a very expensive issue for the practice. So broken schedules is an issue of also connection and communication, and I'm going to take you through these frameworks. The third issue that I've identified that is very costly for the practice and easy to fix when it comes to building this relationship is the issue of drive-by patients. That's what I think they're commonly referred to when they come in for an exam, right? They have that coupon that you paid to get printed and to mail out. And they come in with that coupon, which is already a discounted service because, let's face it, that's how you bring them in the first place. And now they're in here with this coupon, these 10 people. And out of those 10 people, 7 of those run for the hills when you present a treatment plan after they got an exam done. Well, some of you may think that that's normal, actually pretty good. 30% case acceptance, I think is like 20 to 30% nationally. Just imagine. What happens to all those other 7 patients? Where are they going? Are they going to the dentist down the road? Are they going to your competition? Who are they feeding? And why can't we keep them? Those are who I call drive-by patients. And even out of those 3 patients that stayed, you may present a treatment plan that is this big, has 6 things on it. And then they do the first one because that's what was hurting. And then they're gone because you didn't really quite build that relationship strongly enough. So if we think of dentistry as having those main issues of weak relationships, which obviously doesn't turn into referrals, broken schedules, which of course is very costly, and then drive-by patients, which is also very costly. It just adds to the money that you're not making because the discounted service, well, you get it. It's it's a multitude of issues that add up to a big problem. So if those are the 3 main issues, how would we like to ideally receive from these issues? How, if we could switch those, just flip a switch and get the opposite, what would it be? So in the foundational part down here, where we have weak relationships, I like to think of the ideal scenario as being endless referrals. Because when you have strong relationships, remember, that patient that was thinking about going with you or somebody else, well, they have built a relationship with you. Most likely they're going to go with you. It is our job to build that relationship with our patients, isn't it? So If our goal is to have endless referrals, I have broken this down into 2 different modules for the entire presentation. Of course, here, like I said, I'm going to give you, out of these modules, we have one framework, which is the easy influence path. And I'm going to give you the key item from this entire point of the presentation. So, when you are looking for endless referrals, you must be able to build rapport and trust. And you absolutely must have an ability to influence and motivate. So motivation and influence and rapport and trust are the 2 modules, if you will, that make up this endless referrals area of the presentation. We'll go through the main point of the easy influence path in a little bit. Let's move on to the ideal. If we have broken schedules on that second leg right here of the triangle, if we have broken schedules, what would be ideal to have instead? I like to think of it as smooth schedules, an easygoing day. So smooth schedules is what I put up here just to make it something that is easy to shoot for. So thinking about smooth schedules, there are, again, 2 sort of areas where I have broken this down to be able to teach it to you and your team in a way that is concise and easy to implement. And the first one is how to establish and demonstrate need and value. And that goes right up here. And then also how to help those people deal with habits and fears. Because think about what happens when somebody is fearful of going to the dentist. Sometimes the time comes, the day comes, and they go, oh my gosh, I want to hide like an ostrich, right? I want to put my head in the sand and nobody's calling me, and then tomorrow I'll be like, oh my gosh, I forgot, I'm sorry. And you know how often that happens? It happens more often than we'd like to admit it. So helping your patients deal with their habits and their fears is going to show them, first of all, that you care, which helps a lot when it comes to building that relationship. And then is going to also help them help you, because you're going to spend less time in the chair dealing with issues, because they're going to be better patients to begin with. They're going to be comfortable and relaxed because you have actually addressed the issues. The framework that I have set up for the broken schedules area of this presentation is called the no-show eliminator. And I've been using this for the last 11 years or so, and it works really well. So I'm going to give you the key item from that framework in just a minute. Let's move on to the third leg of this. If we have drive-by patients and we want the opposite, what I like to think of is lifetime patients. Making your patients jump from drive-by patient to lifetime patient, a patient that really is endeared to your practice. They will bring their friends and family. They will talk about you when somebody says, oh man, I need to go to the dentist. They'll go, I know somebody. That's because you've built that relationship. So if we want to go from drive-by patients to lifetime patients, what I have set up again here is 2 things. Predictable? Yes. So in these 2 areas that we're going to focus on this section of the drive-by patients, meaning improving our case acceptance, right, is how do we get, if right now 7 of those people are running out, how do we get only 3 of those to run out? What would it mean for your practice if instead of 3 people out of 10 saying yes to a treatment you're offering, what would it do to your practice if you had 5 people saying yes, or 6 people, or 7 people? Think about it. Think about the multiplier effect. If every week you have this many patients, and all of those that were running away now, a good percentage of them are staying with you and becoming patients. Think about how that would make your practice thrive. It would be amazing, wouldn't it? Absolutely. So what we do for turning those patients from drive-by into lifetime is, first of all, be able to manage their expectations and the perception of dentistry. Meaning, how do we handle them from the beginning to know that, yes, they're coming in for an exam with a discounted coupon, for example, but we are going to follow our standard of care and show them all the options and all the things that they absolutely need or should have to have the best possible oral health. Do they want that? Each patient needs to be communicated a little bit differently. But your ability to manage their expectations and the perception of dentistry by just being more than what they expect is important. So that's point number one on the drive-by patients. And the second section of this is the actual presenting and collecting, which is difficult, right? Is the time when you actually have to sit down and go, hey, Mr. or Mrs. Patient, here's what's wrong. Where do you want to start? And you are essentially a salesperson. Even if you don't want to think about yourself that way, you are, right? So you have to be able to connect with the patients in a way that doesn't get them to feel like they're getting sold something that they don't understand or they don't quite need, but rather that you are part of their team and you're helping them make a decision that is good for them, right? It's all in the best interest of the patient. And in turn, that builds the practice. So it's really in the best interest of the practice as well. So those are sort of the three categories, the three areas that the patient experience blueprint takes you through. And I like to think of this as the stress-free path to happy dentistry. Because of that bit of feedback that I got from that Canadian doctor about, I didn't know I could practice dentistry without stress. That's the motivation, is making your profession better and making the profession as a whole better also for the patients and everybody, all of us who work in the dental profession. So let's move forward a little bit because I have set up 3 frameworks, one framework for each of these sections. And since I don't have enough time or the full presentation to give you what the framework is, for example, this is the Easy Influence Path. If you have the download, you have this, you can see it for yourself. But the Easy Influence Path has 6 areas, and each of these frameworks is similar, is set up in a similar way. And I don't have time to go through all of those areas, but what I am going to do is I'm going to give you the main idea or the main concept that if you grasp from that worksheet, from that framework, you will be able to make a huge improvement in your practice. So, if you're ready, let's move forward into the Easy Influence Path. The Easy Influence Path has 6 areas, which I'm going to just read to you. They are build rapport, elicit criteria, identify want and need, intensify negatives, demonstrate value, and then present options. This is the entire path, sort of step by step, that I like to think of taking my dental practices through so that they understand the flow of that kind of conversation, that influential conversation that they want to have with their patients. Because you want to influence your patients to do what's in their best interest, don't you? I mean, that's what dentistry is all about. The main point in this whole thing is not even on this sheet because it's sort of a combination of things, and it is the concept of pacing and leading. So pacing and leading means that you are able to demonstrate an understanding of what your patient is feeling or where your patient is at in the moment, and you're able to meet them there before you try to take them somewhere else. I'll give you a very simplistic example. A patient comes in and they are a little bit nervous, and you open the door and you notice they're a little nervous, and instead of saying anything, you just let them in, you let them sit down, and you go away. That is not pacing and leading. That is not demonstrating an understanding and acting sympathetically and empathetically and helping the patient go through an experience. By contrast, what I would recommend is that you pace and lead, which means you demonstrate an understanding. Hi, Mary. Oh my gosh, you seem a little bit nervous today. What's going on? And then Mary could spend that minute-long walk or 30-second walk into the operatory telling you how much she hates dentists and how much she's afraid of the finances and she's afraid of needles and how much she's imagining that it's going to hurt or whatever issue Mary had. Now we're able to deal with it a little easier because we're able to lead. We have paced. We have demonstrated that we care. That is step number 1. So in that whole Easy Influence Path, if you're taking anybody from point A to point B, the best and most important thing is to pace and lead. To not simply stand over here like you're on the hill and go, hey, get over this way. But rather to go down there and say, hey, you guys want to come this way? And then lead. That is how a conversation that is influential will be most useful and most well done by you. So in the Easy Influence Path, think about pacing and leading. Let's move on to the next bit right here, which is the no-show eliminator. And surprise, surprise, the no-show eliminator also has those same 6 blocks. And this is a process that in my first job as a dental office manager, I picked up thousands of phone calls and set up appointments. This was an emergency dental clinic, and we had calls all day long with people needing an appointment. So I got really good at gauging what happened, handling the conversation, and closing them on being there to pay cash. It was an interesting experience, to say the least. And as a hypnotist, it got me to realize after a little while, like, hey, I know this stuff. I should be able to lead them through a conversation and influence them. And this is how the no-show eliminator was born. So the 6 areas, the 6 steps right here are rapport, fit, value, schedule, let go, and commit and confirm. And I'm going to give you the key element in all of this is a double commitment. So you commit them to, yes, the appointment time that they chose and that you have collectively chosen. That's commitment number 1. And then here's the key and the second commitment, which is actually in this, the important part is right here in this let go step. It's saying something along the lines of, Mary, I always have a patient that's called Mary. That's just the way it is. Mary, thank you so much. I got you scheduled for Thursday at 2 p.m. Hey, listen, if there's anything that happens that will keep you from being here, would you please give me a call and let me know? I'm the one that's in charge of making sure our schedules are smooth, and I need to make sure we're on time. And Mary will most likely, like 99% of the patients that I said something like that to, will say, oh, of course, I wouldn't leave you hanging. And when they say that, they wouldn't leave you hanging. But think about this scenario. Think about you maybe being the patient who is a little bit anxious, who is a little bit apprehensive about that dentist or about that particular appointment or whatever it is that they're apprehensive about. If you're apprehensive and the day comes and they have twisted your arm with a $100 cancellation fee, and they have twisted your arm by calling you a million times, and they haven't used the process, but you feel like you're being forced, that day comes around and you're like, I have this to do, or I have the dentist. Oh my gosh, I think I'd rather just not go to the dentist and pay the $100 next time if they charge it, or I'll just go somewhere else, because they will jump dentists like that. And then you are left holding the bag. It's not a good way to go. Now, I understand the not wanting to give them an out, not wanting to give your patients the freedom to go somewhere else if they have an issue. But when you do that, then they feel free and they feel attached to you, and then they will call you. And if they call you 2 hours from their appointment and they say, oh my gosh, I went to lunch with so-and-so and I forgot my appointment today, then you say, you know what, no problem. I have a short list. Because if they call you with 2 hours in advance or 1 hour in advance or even almost in the moment, you can make some arrangements. But when you are sitting there 10 minutes after their appointment time, 15 minutes after their appointment time, you're making a call, hey, are you still coming? You are already in the losing side of things, okay? So letting patients go, allowing them to feel the freedom, like they have some autonomy over this. Like, hey, listen, if something happens, we know life is busy. If something happens, would you please let me know really quick? I'm the one that's responsible for keeping the schedule going. Yeah, and I would use that sort of plea to our patients, because we must appeal to them in ways. So that's the key. The first was a confirmation that, yes, that appointment time works for me, and letting them go. And the second confirmation, so a double confirmation, the second confirmation being that, yes, they would let me know if for any reason they can't make it. Okay, so that leaves it open for them to decide. Sometimes there's still that $50 or $100 cancellation fee. That's okay. They still understand that. However, the relationship is built a little bit differently, and that's again what this entire program is all about. If you get nothing out of this, you should get that it's all about building that relationship with your patient. Like, you want to be friends, you want to have them for a long time, right? Then treat them like a friend. All right, let's move on. The third framework that works with the drive-by patient section is called the cooperative treatment presentation. And again, it has 6 different areas that I'm going to take you through real quickly. And then I'm going to give you the key element. The 6 areas are plant seeds, then listen, empathize, educate, ask, and collect. Okay? If you just look at those titles, you would be able to follow the process and allow the patient to sort of feel like they're part of the process. So the key item, the key element in this entire thing, it's in the name. The cooperative treatment presentation, which is a name that I came up with after seeing multiple doctors present in different ways and really talking to one doctor who had, I think, a very masterful presentation after talking about certain issues that they were concerned, that they might be of concern. This doctor would say something like, now, Mr. Patient, the way I see it, you have 3 options right now. Option number 1 is you do nothing. And the patient goes, what? A little bit of a shock. But is it true? Do they have that option? Yes, they always have that option, right? You want that, you want to keep the pain that you have? That's okay. I mean, it's your choice, right? So doctors would say, number 1 is do nothing and just keep the way it's going. The patient go, okay, no. Then doctor would say, option number 2 would be to do this, X and Y. And that would be a sort of minimal fix. And then option number 3 would be the top option, like what the patient should do, what the standard of care really needs to be. And the doctor would say, and number 3 would be this. And Mr. Patient, if it were my mouth, I would definitely go with this because blah, blah, blah. And they would explain the options and why. Why this is important is because a patient is making a decision about their health. And when dental professionals that I've seen deliver a treatment plan, a lot of times it's like, okay, so here's what the doctor recommends, and so I think we need to schedule this for whenever you're available. Then we'll try to do like a monthly thing, and it's just like jumping into certain details that are too far. In the cooperative treatment presentation, TM, what I like to think of is bringing the patient in, involving them so much more in the process that they are making the decision together with you instead of feeling like they have to run. Okay, so the cooperative is the key element here. Is, Mr. Patient, here's some options. Rather than saying you have no options, here's some options. Here's what I would do if it were my mouth. And, we all care about you. Just showing that care goes a really long way. So when you follow the key elements in each of these simple frameworks, you get the blueprint. The blueprint that motivates happy dentistry at your practice. Wouldn't that be an amazing goal to have? Wouldn't that be just awesome? Think about what would happen in the next few days, okay? If you were to just take these ideas of pacing and leading and noticing what the patient is doing and then leading them in a more gentle way. And if you were to think of letting the patient go, hey, listen, I know we're scheduled, but if you can't make it, can you at least let us know? That's the second step. And then using this and giving your patient options. Imagine yourself in the next few weeks or the next few months starting to use this so effectively that you do increase that case acceptance, that more of your patients who were not showing up are actually now showing up, that more of your patients who were not referring their friends and family are now referring their friends and family. Think about what that could do if you were to just make a few simple changes, okay? And I hope that we will get together for some more of this. Let me just tell you really quickly the few other things that you've downloaded, because if you got the blueprint handout, then you also have the patient comfort intake, for which I have another video that takes you through it and explains why it's important. You also have the dental practice optimization assessment, which is what I use with the practices that I work with, so that we can have a starting point of what they feel like their patient experience is like and how we can improve from there. And then you will also have the hypnotic techniques for dental professionals. It's a handout with 2 hypnotherapy based NLP based techniques that are like 5 minutes long that you can use with your patients who are anxious, who are fearful, to help them change their state. And there's also, again, videos with each of these parts of the packet. I just figure for the download, since it goes with the presentation, I would put it into one packet. So there you go. You have it all. You can start reading through it and find the videos for the rest of this. Now, you can also start with my book, Hypnodontics, Ethical Influence, Language for Dental Professionals. Why do I call it ethical influence? Because it's our job to influence our patients to do what's in their best interest, right? And it's ethical because it is their best interest, not our best interest, right? So I like to think of it as, yes, we're learning to influence. Yes, we're learning to persuade. Are you hypnotizing your patients? Well, yes, it's hypnotic communication, but it doesn't mean that we're pocket watch hypnotizing our patients and doing things that they don't want. Does that make sense? It just doesn't work that way. If you want a crash course in this communication style and how you can make simple changes in your practice that can add up to huge benefit, you can definitely start with my book, Hypnodontics. You can find it on Amazon and have it in a day or two, and it's got pretty good reviews, so check it out. And then finally, if you'd like any sort of help with implementation or taking your team through an experience where they can feel maybe so happy to be at work that they want to help the practice grow this way, then I would love for us to connect. You can always find me at hypnodontist.com. You can email me directly at juan@hypnodontist.com. And that is about it for me for now. I hope you have enjoyed this short presentation on the patient experience blueprint, and I'll see you next time. Thanks for joining me.